Hello class, I am Tricia Loukes and I'm going to tell you about the disorder Oppositional Defiant disorder, which I researched about for this teaching event. The Oppositional Defiant disorder is defined as a recurrent pattern of negativity, defiant, disobedient, and hostile behavior, especially towards authority figures. ODD is one of the most commonly diagnosed mental health conditions for children. ODD occurs more in boys than in girls, and 20% of school-age children will have it at one point. The disorder starts typically at age 8, but can start as early as preschool. If a child has been displaying disruptive behavior for up to 6 months and is persistent in disrupting the school or home environment, the child likely has oppositional defiant disorder. There are many symptoms and signs of ODD that one can observe in children. These signs gradually worsen over time. Some symptoms of ODD are the following: being negative often, being defiant and disobedient, refusing to listen to authority figures, having temper tantrums and arguing often, annoying others on purpose, and tending to blame others for their actions and mistakes. Children with ODD also have difficulty maintaining friendships, and they usually have academic problems in school, typically have a low self-esteem, and tend to act aggressively often. Oppositional defiant disorder often occurs along with other behavioral or mental health problems such as ADHD, anxiety, and depression. There is no clear cause for ODD. Some people believe that causes and risk factors are having lack of supervision or harsh and inconsistent discipline, being abused or neglected, having an imbalance of brain chemicals such as serotonin, and having a developmental delay. There are some treatments available for this disorder, such as individual and family therapy, parent-child interaction therapy, cognitive problem-solving training, social skills training, and parent training. Social skills training would help students to better their communication skills and focus on building relationships and teach students how to express themselves. Problem-solving skills training allows for students to be more independent on solving problems and conflict resolution. Parent training would allow parents to learn how to address behavioral issues in a positive way. The training would also teach parents to be positive role models in any given situation. Parents can teach their children how to handle problems and how to behave appropriately in school. Children with oppositional defiant disorder are usually defiant and disobedient at a young age. Surprisingly, ODD is one of the most commonly diagnosed mental health conditions for children. The children that have ODD tend to portray disobedient behavior toward authority, mainly. It would be hard to recognize a child having ODD just because children tend to misbehave and have temper tantrums at a young age. The difference is that children with ODD, these tantrums are more frequent and persistent, lasting 6 months or more. Symptoms of ODD are the following: a child feeling angry, acting aggressive, having a low self-esteem, a child who doesn't take responsibility for his or her own actions and behaviors, having no or a small amount of friends. These signs will be apparent when a child is in preschool up to age 8. ODD is diagnosed professionally by a variety of tools or procedures such as the National Initiative for Children's Healthcare Quality Vanderbilt Assessment Scale and the SNAP-IV Teacher and Parent Rating Scale, which are both used to detect ADHD but can help identify ODD. Another screening tool, pediatric symptom checklists, are used to detect cognitive, emotional, or behavioral problems which could lead to ODD. If a child has ADHD, they are likely to have ODD. Approximately 40% do. There are potential risk factors that make the likelihood of getting ODD higher. Some risk factors are being raised by a single parent, coming from a poor family, being chronically obese, and having a family history of ODD. The first step in diagnosing the disorder is to determine whether the disorder exists by evaluating the duration and degree of the behavior. For a diagnosis to be completed, a child's behavior must do the following: cause problems at school or home, occur on its own, and must not meet the diagnostic criteria for conduct disorder. In some cases, it's necessary for children to be evaluated by a psychiatrist and psychologist. As an educator, it will be hard to distinguish typically developed children from those who have ODD. Most students misbehave, and it could go unrecognized in a classroom setting. If a child is constantly misbehaving and getting in trouble, challenging the adult, not following rules, the child may have ODD. If the misbehavior occurs for a long period of time, it may be worth looking into, speaking with parents, sending a referral, and observing the child more closely. Oppositional defiant disorder, like I said before, is a disorder that is accompanied by disruptive behavior with the refusal to comply and listen to authority figures. In any classroom, students will come with a diverse set of needs, and students with oppositional defiant disorder need specific behavior guidelines, rules, modifications, and adapted instruction in order for them to learn and succeed in the classroom. Many strategies and techniques exist that a teacher can implement and use in the classroom to assist students with ODD. A teacher could assist students with oppositional defiant disorder by having classroom rules set up and implementing quick, smooth transitions between activities to lessen class disruptions. If the students are able to participate in creating the class rules, they are more likely to follow the rules. By helping creating the rules, students will know they are responsible for their own actions. A teacher could teach students effective ways to express themselves by modeling good behavior and role-playing scenarios on how to express feelings. Students with oppositional defiant disorder should be seated up front, close to the teacher for limited distractions. To modify instruction, teachers should provide one instruction at a time, repeat instructions, and keep all instructions brief, and to make sure to break assignments into steps to prevent students from getting overwhelmed. Along with oral instructions, a teacher should provide written instructions and visual aids when needed. Students with oppositional defiant disorder need a very structured classroom setting in which rules and expectations are clear, predictable, and known in advance. There are also modifications for students. A teacher should also make the following modifications for students with oppositional defiant disorder. Give students frequent breaks, give students positive reinforcement and reward good behaviors often, give students choices, reduce the amount of homework assigned, and allow extra time to complete assignments. It is really important to focus more on acknowledging good behavior instead of correcting bad behavior. Teachers should aim for a ratio of 4-to-1 positive reinforcements to corrections daily, because the bad behavior has been known to get more attention from teachers, so it is important to be aware of the effects of attending to positive and negative behaviors. If a teacher acknowledges positive behavior, it is likely to increase the student's self-esteem, and the good behavior will be repeated. Many trainings and programs could be implemented to help assist students with oppositional defiant disorder along with their families as well. Some behavioral programs that are available are the following: parent management training and collaborative problem solving. Some students would benefit from social skills training, assertive training, and problem-solving skills training. Doing relaxation techniques would also be a beneficial technique to prevent classroom outbursts and could be used to calm students' anger and emotions before they get out of control. Social skills training would help students to better their communication skills and focus on building relationships and teach students how to express themselves. Problem-solving skills training allows for students to be more independent on solving problems and conflict resolution. Parent management training would allow parents to learn how to address behavioral issues in a positive way. The training would also teach parents to be positive role models in any given situation. Parents can teach their children how to handle problems and how to behave appropriately in school. Another training that could be implemented is attribution training. Students who exhibit oppositional defiant behaviors can benefit from attribution training, which involves teaching them to understand how their actions affect their success and failure. Using the attribution training, students would be more aware of their behaviors and take responsibilities for their actions. In an article written by Barry Fields titled "Getting the Balance Right," it focused on acknowledging good behavior. It also discussed an appropriate program that would be beneficial to use in the classroom and school setting. The program is called Positive Behavior Support, PBS, and discussed a school-wide approach on behavior modification, rules and expectations that the whole school follows by, ways and strategies to prevent bad behavior, and necessary teacher expectations and skills. A school-wide approach and behavior policy would give each classroom a set of expectations to follow by. Having such guidelines and rules laid out would let students with oppositional defiant disorder know what to expect and how to behave. For all students in the classroom, a teacher should collaborate and communicate with the students' families because it can strengthen the connection between school and home and create a shared commitment to learning. By working and collaborating along with families side by side, a teacher is more able to see what works at home for behavior modification and seek advice and suggestions from the parents. Parents can also look to the teacher for the same advice. Another modification that teachers could adapt and use in the classroom would be to create a behavioral contract where a few goals or targets are chosen and created for the students to meet. Their progress would be monitored and tracked along with their behavior, and the students would be rewarded for reaching the goals and for any positive behaviors at this time. Although there are many interventions, trainings, programs, strategies, and techniques to implement in the classroom for the betterment of all students, but primarily for students with oppositional defiant disorder, each class will have a different way of addressing the needs of the students in the classroom. Classroom management skills will definitely be needed, and each teacher will have their own strategies to implement and use. Differentiated instruction also definitely helps all learners, specifically ones with oppositional defiant disorder. It is at the utmost importance that all teachers with exceptional students must build cooperative relationships, build positive social skills, collaborate with families, be clear and fair, have positive expectations, and implement positive reinforcement. Also, to avoid power struggles, help students manage their behavior, and provide engaging learning activities.